The dramatic rise in new cases in recent weeks is showing up in Tennessee hospitals, with the number of COVID-19 patients setting new records almost every day.
And it's not just the number of hospital beds that now worries experts. There's also growing concern about having the doctors and nurses to staff them. News Channel 5's chief investigative reporter Phil Williams continues to track these critical numbers. Phil.
Well, Vicki, the number of people hospitalized on any given day is growing dramatically. And as COVID-19 spreads, it's also hitting members of the medical community, cutting into the numbers of doctors and nurses needed to treat those patients.
So hospital capacity is not critical, but it is, if we're not paying attention to it, it very well can become critical. I think
Dr. Alex Jahangir splits his days between his duties as an orthopedic surgeon at Vanderbilt.
And with the high number of new cases, our resources could get stretched.
And his job as the head of the Metro Board of Health.
And right now, COVID is very real. The numbers are going up. And these people who are coming into our hospitals are sicker and sicker each day.
And just as experts had seen in other parts of the country, the dramatic rise in COVID-19 cases is now showing up in the number of hospital patients statewide, going from 117 patients with confirmed COVID diagnoses on April the 1st to 295 on May 1st, just taking up to 308 by June 1st. But by July, the number of patients had shot up to 632, hitting 984 at mid-month. There are another 432 suspected COVID patients awaiting confirmation.
Our metro areas, specifically Memphis and Nashville, but quite frankly in all 6 of our metro areas where our large health systems are, they're starting to feel some strain from the increased hospitalization and ICU rates.
Earlier this week, State Health Commissioner Lisa Piercy said officials are closely watching hospital capacity. As of Wednesday, the number of available hospital beds statewide had dropped to 17%. Intensive care beds were at 16%, leaving just 326 available across Tennessee. And because Nashville hospitals treat people from Tennessee, Kentucky, and Alabama, they have to worry about more than just a rising caseload among Nashville residents.
You can have 1 million beds, but if you only have 10 nurses or doctors because all the other doctors and nurses are not able to work because maybe they're sick or maybe they just aren't at the hospital, you can't fill up 1 million beds with patients.
And hospital staffing, Jahangir says, is becoming a bigger issue.
There are more and more people in healthcare, so nurses, doctors, therapists, who are getting COVID because the number of cases of COVID are going up in our city. And a lot of these people are actually getting it not in the hospital, but out in the community.
Now, earlier this week, Governor Bill Lee said the state has plans for creating surge capacity, additional hospital beds if they are needed. Of course, that does not solve the emerging staffing problems. That's why Dr. Jahangir says it's now more important than ever to frequently wash your hands, socially distance, and wear masks when you're out in public. Vicki?